Evening. My name is Beverly Osby-Fulks, and I am a Maryville University student in their F&P program. Tonight, I'm going to be doing a head-to-toe assessment on Carl. Carl is my son, and he's also volunteered to be my patient tonight. Before we got started, I explained to Carl what we would be doing, allowed him to empty his bladder. I washed my hands thoroughly, and we did the eye testing using for far vision the Snelling's chart, and for near vision the Romberg chart. So we did all of that stuff before we got started. We got a full set of vitals, including his height and his weight. So we'll now get started with the general assessment. Carl, if you could sit and turn facing me. So when I look at Carl, his head seems like it's symmetrical. I'm going to touch his head, palpate it, to make sure that I don't feel any lumps or bumps, any type of nodules or masses. When I touch his hair, it's soft and it's moist. So now we're going to continue with the face and the head assessment. We're going to assess cranial nerves. So can you sit up straight, Carl? Thank you. So, Carl, can you squeeze your eyes shut? Wrinkle up your forehead. Wrinkle up your forehead. Lift your eyebrows. There you go. I'm going to have you puff out your cheeks. Smile with a big grin. Stick out your tongue. Stick out your tongue. Thank you. I'm also going to have you say ah. Ah. When I look in Carl's mouth, I see... No, Carl. Can you stick your tongue straight down and stop licking the bottom of your... Like this, look. Thank you. Ah. When I look in Carl's mouth, since we're at this point, he's got... You can stop saying ah. He's got... Open your mouth wide. He's got all of his teeth. His mucosa is pink and moist. I can see his uvula, his hard palate, his soft palate, and his tonsils are still within the border. Okay, thank you so much, Carl. Conjunctiva on the left, it is pink, it's moist. His sclera is white. On the right, again, pink, moist. His sclera is white. I am going to also check Carl for his pupillary response. So could you cover one of your eyes for me with your hand? That's great. And I just want you to find a spot back here on the wall and look straight at that spot and open up your eye. Now take this hand down and cover up your other eye. And I need you to look great. And so I don't notice any nystagmus or any type of involuntary movements. You can put your hand down. I'm also going to check his pupils for response. I'm going to do direct and consensual pupillary responses. So on the left, if you could just look at me, please. Direct and consensual. On the right, look at me. Direct and consensual. Okay, I'm going to have you look at my pen light. Or just look at the pen. And we're going to do the 6 cardinal eye movements, or 6 cardinal movements of gaze. I want you to follow the pen light with your eyes without moving your head, okay? No, move your head. Very good, Carl. And I noticed that Carl had no nystagmus or involuntary movements when we did the 6 cardinal signs of gaze, which would also test his cranial nerves. Okay, Carl, I'm going to look in your nose. Can you hold your nose? You hold your head up a little bit. Now look in Carl's nose. I see he does have a little drainage in his nose. His septum is midline, and he does not have any septal perforation. The turbinates on the right side are a little swollen. and a little red. The turbinate on the left side is normal size. Okay, Cole, I want to have you put your head just in the regular position. And I want you to take your finger and occlude your nose, one there, and take a deep breath. Okay, and let it out. And then I want you to do the same thing on the other side. And let it out. Did that cause you any pain, or do you have any problems with it?
The right side.
The right side hurt.
Well, it's a little bit difficult to breathe in on the right side.
Okay, so he may have a little bit of nerve obstruction on that right side, and that was the side that he had the swollen turbinate on. I think I'm gonna do, we checked your reflex. I'm gonna check your gag reflex now. This also is testing a cranial nerve. If you can open up your mouth and stick your tongue out. All right, he does have positive gag reflex, and that's what we would expect to see. The next thing that I'm going to do, inspect his ears for alignment. So when I look at his ears, here, look at me. When I look at his ears, they are aligned with his, in the right position for his eyes, where, to meet up with his eyes. Also, when I check his auricle, it's not painful. It's soft, it's supple. There aren't any type of nodules or masses. When I do it on the right side, it's this exact same. And so his auricles are symmetrical. Now I'm going to check his the inner ear. I'm going to check his ear canal. I'm going to also check his TMs to see how they look. Gonna get the otoscope. Gonna turn on the otoscope. I have good light. I'm gonna pull his auricle up and out. Gonna look at his ear. When I look at his ear, he has rumen in his ear, but I can visualize the tympanic membrane. It is a pearly, whitish gray color, and I can visualize the bony structures. Gonna do the same thing on the left side. Gonna pull the auricle up and out. Gonna look in his ear. I can visualize again cerumen. I can also visualize his TMs, which are pearly white. In continuation with the examination of Cole's ears, I need you to turn towards the camera. I need you to cover your left ear and repeat. Can you scoot up some? Just scoot up some. Thank you. Cover your left ear, and I'm going to whisper a word, and I just want you to repeat it.
Apple.
Cover your right ear.
Orange.
Great. Now I want you to turn around, face me, and I have the tuning fork, and what we're going to do is we're going to do a Weber test initially. Cole, I'm going to strike the tuning fork. I need you to move your hands. Put your feet down. I'm going to strike the tuning fork, and I'm going to place it on your head, and let me know if you can hear it equally in both ears, okay?
Okay.
Great. Now we're going to do the Rene test, and what I'm going to do is I'm going to strike the tuning fork. I'm going to put it on Cole's mastoid process coil, which is the bone right behind your ear, and I want you to tell me when you stop hearing the sound. And once you stop hearing it, I'm going to move it next to your ear, and then you tell me when you stop hearing the sound. This is the Rene test. You hear it now?
Yes, I do.
Tell me when you don't hear it.
No, I don't.
So as you notice, air conduction is about twice as long as bone conduction.
We're going to repeat the process on the left side here. Let me know when you don't hear the sound. Sorry?
I don't hear you.
Okay. What about now?
I don't hear you. I hear you now.
Show me when it stops.
It stopped.
Okay, what about now?
I hear you.
Tell me when it stops.
And it stopped.
Do a sensation test. I want you to close your eyes for me. Hold your head up and sit up straight, please. Tell me what you feel and where you feel it.
Cotton ball on my forehead. On my chin. Left cheek. Right cheek.
Great. So his sensation is intact on his face. And again, this is also testing for his cranial nerves to make sure that they're intact and that they're working. Now we're going to palpate for his lymph nodes. We're going to start with the preauricular lymph nodes. Postauricular, occipital, tonsillar, submandible, submental,
So now I'm going to percuss Claw's anterior chest. And you sit up straight for me. Thank you. I'm also going to palpate Claw's inferior clavicular node and its axilla node. Thank you, Claw.
Just to kind of back up. Oh, I'm gonna have you lay down now. I'm gonna have you pull your shirt up to reveal your belly, and then I'm gonna have you just kind of slide your shorts down just a little bit, not all the way down, but just a little bit. Okay. And just to back up, when we checked Carl's heart tones and we checked his aortic, pulmonic, Earth's point, tricuspid, and mitral heart tones, he did have a regular rate and a regular rhythm. So now we're going to do his abdominal exam. I'm going to use the pen light to look for any different types of contours and pulsations in Carl's abdomen, and I don't see any. Carl has hair on his abdomen, and it seems to be equally distributed. I'm going to auscultate Carl's abdomen for his vowel sounds. I'm going to start in the right lower quadrant. Can you lay flat because you got your muscles? Carl has good abdominal muscles. And on a patient that has absent bowel sounds, you may have to listen for greater than 2 minutes to determine if the patient has absent bowel sounds. And Carl has positive bowel sounds in all 4 quadrants. I'm going to listen for Carl's aorta. on the left, renal artery on the right, iliac artery on the left, iliac artery on the right, femoral artery, femoral artery on the right. Thank you, Cole. Okay, I'm trying to see what's my next thing. I'm gonna percuss, call his liver borders. I need you to put your arm down. So I'm gonna start at the top and start percussing. When you have dullness and his liver borders, I'm gonna start at the bottom and come up to establish. This calls liver border. Gonna do the same thing for call spleen. Okay. I'm also gonna do light palpation across abdomen. You let me know if this is causing you any pain. Now I'm going to do deep palpation. Can palpate cause liver border. I'm going to come over and do the same thing on this side. And I should not be able to palpate his spleen, and I cannot. While I'm over here, I'm going to palpate his left kidney, the right kidney, I'm feeling masses in his abdomen. I'm going to palpate his aorta. Awesome. Thank you, Cole. I want you to kind of flex up a little bit and flex those muscles, and that's good. Do what you just did. Flex up, Cole. There you go. And you can feel Cole's abdominal muscles. Great, thank you. You can relax now. Whew. Okay. I want you to sit up. I want you to lift your arms out for me.
Forward to the
Just
side.
forward towards me. Looking at Cole's arms, they are symmetrical. He's got even distribution of hair. His inside of his arms are a little lighter than the outside of his arms, so the color is a little bit different. His arms are warm to touch. I'm going to push down on your arms, and you push up against me. Push down. Great. Now look at his fingers. He doesn't have any clubbing. His capillary refill is about 3 seconds bilaterally. I want you to push up. Can you scoot forward? I want you to push up with your shoulders. Shrug, shrug, shrug. I want you to push against my hand. Turn your head against my hand. Okay, let's do it on this side. He's got good strength. Okay. I want you to go forward. Put your head down. Ears side to side. Put your head back up. All the way back. I want you to put your ear to one side and your ear to the other side. Okay, and I want you to turn your head and look toward the camera, and turn your head and look toward the wall. You can open your eyes. You can look back at me. Okay. So now I'm going to look at Cole's legs. When I look at Cole's legs, he's got dry skin, but he's got hair evenly distributed on his legs. When I palpate his popliteal pulse, it is present on the right. It is also present on the left. I'm going to palpate his posterior tibialis pulse. It is present, 2+ on both sides. I'm going to palpate his dorsalis pedis. And it's present on both sides. Can you push up against my hand? Push up against this hand. Great. push up with your knees. Awesome. I'm going to check your reflexes now. Well, actually, I'm going to check his pulses. His radial pulse on the right is 2 plus. His brachial pulse is 2 plus. On the left, it's 2 plus. And on the left, is brachial, is 2 plus. I'm going to get my reflex hammer. I'm so sorry. Sorry about your foot. Just relax your arm. Relax. Let me hold it. It's got good reflexes on the right. I'm going to do the same thing on the left. Just relax your arm. Great. Gonna try the same thing with your knees. Can you sit back a little bit so your feet can kind of dangle? Awesome. I'm gonna give you a little strike with the hammer. And do it on the left. Also gonna do your Achilles tendon. Can you scoot forward a little bit? You gotta relax your legs for it to work. And great. I'm gonna have you stand up. I'm gonna have you turn toward the wall. This wall. Okay, I'm gonna palpate Paul's cervical spine. His thoracic spine, lumbar spine. Does that hurt?
No.
Have you bent forward as far as you can? I don't notice any kyphosis or abnormal curvature of his spine. You can stand up straight. And turn around. And this concludes my head to toe examination for my advanced health assessment class. Thank you so much.